The Dental Download podcast is your source for insight into dental school, conversations with dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Haley Schultz. Let's get into this week's episode. Hello everyone, happy Monday. Welcome back to another episode of the Dental Download podcast. And if you're listening the day this goes up, Martin Luther King Jr. Day, I figured a lot of people that listen to my podcast based on the analytics are students as well, so you probably also don't have school, so you probably also slept in. I'm coming off of a dental conference weekend, so I was super exhausted on Sunday yesterday when we got back, and I figured I would just record it real time on Monday today, January 17th. I'll give a quick recap of what my weekend was like with the ASDA District 6 conference in Columbus, Ohio, and also what went on last week in dental school. And then we'll get right into this week's episode, which is a solo episode. So it's just me this week, and I'm going to be recapping the last semester of dental school that I had, which was my D2 second year fall semester. So I'll go through all of the classes and kind of talk about some of the highlights, the lowlights, and anything notable that happened clinically, extracurricularly, or in life in general, if I think of anything important that I don't want to leave out for you all. But this past week of dental school, we can start there, was Monday, January 10th, and if you follow me at all, you saw that I had a lot going on. I did a few assists. We only have to do 14 this semester compared to last semester. We had to do, I think, 18, which 4 doesn't seem like a big difference, but it really is. Like last time we were assisting once or twice per week, and now it's not even every single week unless you want to do extra. And we have lab from 8 to 11 on Mondays, Wednesdays, and then on Fridays it's 9 to noon. And then we have classes in the afternoons pretty much every single day as well. So we're usually getting home around 3 or 4 p.m. And then I had stuff going on for ASDA. We were filming for our chapter's PFM award video, which is basically an award that Nationals gives out to the school that they feel did the best job at the video, and I was helping put that all together. It basically just summarizes your year as a chapter, and then you can get awarded if you're the best one. So just something to do to showcase our chapter a little bit. And then I had meetings for AO, the dental society that I'm in. It's called an academic preview, and essentially I created slides, a slide for each class that the current D1s are taking, and then I went through and put the class average in there, gave some tips and tricks, talked about whether it was an easy class, a hard class, how the exams were structured, things like that. And then on Tuesday, I still had more filming for ASDA, and I had radiology rotation. I usually dread radiology rotation, but to be honest, it's been not so bad. Like, it's never bad. I just hate going, and I think that the issue is not that I'm not confident taking radiographs. It's that some patients are just challenging. They're challenging for radiographs. They could be challenging for any dental treatment, and not even their personality, just their mouth. And it's not their fault, but they might be missing teeth, which we call edentulous, and that could affect their bite. So the bite plate doesn't stay in there well, and you might have to switch to a different type of x-ray sensor, and it can just be tricky. But this week we had relatively younger patients with pretty healthy dentition, so it was pretty chill. It's just long and kind of dragging, but it's good practice. And then I assisted, and then I led a Bible study for the Christian Dental Association. And after that, when I got home, I also had a Zoom through ASDA hosted by the Michigan Dental Association about insurance, so disability insurance, life insurance. And then next week, well, the week that you're listening to this, we have another Zoom through the MDA about contract negotiation. So they're really great partners for our ASDA chapter, the Michigan Dental Association, or MDA. They're really supportive of our school and of Detroit Mercy School, and try to help us with fundraising, help us with having informative events, connect our D4s with jobs. It's a really great relationship that we have with them, and we're very appreciative of that. And Wednesday also had a bunch going on for clubs. We had an exec meeting planning this large ASDA event that we're hoping to have for our chapter. And then right after that, I jumped on a call for AAWD, where I'm the vice president, and we had another exec meeting just the beginning of the semester. This was our first full week back. And you have to get everything squared away for every club that you're in, and they all just met this week, so that was that. And Thursday, I was assisting. We had a couple classes online, one in person, and then I hosted that actual AO academic preview for the D1s. Monday night was just like our exec meeting for the semester. And then Friday, I went to Denter's Lab. We had our first quiz of the semester. I did okay. I got a 4 out of 5. Obviously, we're always hoping for that 5 out of 5, but it didn't happen this time. And then we had an in-person class till 2, and Amanda and I got in the car and were joined by 2 D4s that we're friends with to drive to Columbus for the District 6 conference. The conference was really great. I don't want to go too into detail about more ASDA things and ASDA conferences and everything, because I'm planning to make an episode about that in a couple weeks, what my experience has been with having positions in our chapter so far, and the conferences, how those work, and just like what is ASDA, kind of ASDA benefits, ASDA membership, ASDA's position and stance on different things happening in the profession and with licensure and everything. I'll try to give you just some basics and resources for people that are current dental students and maybe aren't a part of their ASDA yet, or for people that are incoming and just wondering, what do dental students do with student organizations? Because I would say ASDA is definitely like the biggest dental student organization across every dental school. But that will be our recap for this week. Let's get right into the main episode, where I'll talk a little bit about our class schedule for last semester. Want to make a podcast? Spotify's got a platform that lets you make one super easily and then distribute it everywhere and even earn money, all in one place for free. It's called Spotify for Podcasters. Here's how it works. Spotify for Podcasters lets you record and edit podcasts right away from your phone or computer, so no matter what your setup is like, you can start creating today. Then you can distribute your podcast to Spotify, but also everywhere else podcasts are heard. Video podcasts are also available, and you can earn money in a variety of ways, including ads and podcast subscriptions. Did I mention it is totally free? No catch. I've been using Spotify for Podcasters since the very beginning of my show, and now we're nearing our 200th episode. So I can definitely say it's an easy platform, and I've really loved using it. So be sure to download the Spotify for Podcasters app or go to www.spotify.com/podcasters to get started. Alrighty, so I will go like class by class and just kind of give a recap of how they ran. But before that, I thought it would be most interesting to talk about the notable firsts that we got to have, or notable experiences. So in the intro, I mentioned that we were assisting a lot, and it was a lot more than usual. It was about twice a week. I think I had like 19 or 20 total, and we needed 18. And we did just those normal assists in the VIX clinic, which is our pre-doc clinic, so the D3s and D4s. And then we also had an additional one in grad perio, and we also had one in PACE, which is basically the new patient screening clinic, where they kind of just give them an exam and then assess their needs, and from there they get assigned to students. So those were additional on top of the other like 18, 19, 20, however many I did. And the cool things we got to do in ACE, the biggest thing, which ACE is like our in-person, like hands-on learning clinic. So there's never patients in there. We just practice on each other, or we practice taking radiographs the first time on like the mannequin Dexter. But so for ACE, we got to do anesthesia, which was like the big exciting thing. So local anesthesia injections, which are just like numbing injections. We used Septicaine on each other. And we practiced a few different areas. And I was able to just do that on my roommate because she's in my rotation section. And then our mentor, which is like the D4 directly helping you, was our good friend Haley. So it worked out really well that it was people I already like knew and liked and was comfortable with. And basically each group of 2 students had a 4th-year student mentoring them, plus the actual class faculty, which is a real dentist, practicing dentist, overseeing all of that. But it was nice because you had the one-on-one instruction with the D4 telling you, oh, tilt it this way, or go deeper, make sure you aspirate, all the important things that you need to think about. And then I think our only other ACE sessions was like a diagnostic mounting and maybe one other thing. Diagnostic mounting, we just took impressions of each other again. And the challenging part was then we learned how to use a face bow, transfer jig to kind of take a reading of the person's face that you took an impression of. So you take a reading to get their like infraorbital dimension, and like it just kind of helps you make sure that when you're transferring the cast, so this like solid clay hard mold of their mouth onto the articulator, that you're putting it in the right orientation based on their actual jaw alignment. And the transfer jig helps you do that. So that was something that I'm still not super confident with, but I got more confident as that session went on because we had to practice and had to make it look pretty and everything. But I still end up with bubbles in my pour up casts sometimes, honestly every time. Sometimes they're better than others though, it's like less significant. So if anyone has tips for not getting bubbles in your casts, let me know. All I've heard is making sure that you're pouring the cast on the vibrating plate, but I don't really know the perfect amount of pressure to be applying there, so I think that's part of my issue. And then when you're pouring the liquid into the impression that's going to eventually harden into the cast, you want to pour it really slow and let it just flow into each tooth depression rather than like plopping it in there, because like that motion can create bubbles. But again, I do those things correctly and I still get some bubbles. And then the other thing that my instructor told me when she was looking at my cast and was like, oh, you still have a lot of bubbles here, she said that if you flip your cast paste too fast, so you pour it up and then you build the base and then you're going to put it on like a plastic sheet or a paper towel or something, she says if you flip it too fast, that can also create bubbles. So what I've been doing is trying to let it sit and set when it's the patty that you're making is facing upward rather than placing it down right away. So those are some things I've been working on, but again, it's still not perfect. So if anyone has good tips for casts and you're listening to this, please let me know. But those are the two main ACE things that we had, and we had more radiology rotations. And our schedule, though, was just a lot of assisting overall, and then classes that at that point were still all online other than our sim lab. So we had 2 days of sim lab in the afternoon that were for crown preps, and then as well as making provisional crowns to go over those. And then on Fridays, we had our complete denture lab, which was definitely my least favorite class. But I guess when I talk through class by class, I can let you guys know why it was so challenging. It's not even any instructor's fault or like, it's just no one's fault. Dentures are just complicated, and making them look good on top of being functional is such a skill that I just do not have, which is fair. After your first time ever trying, you're not really going to be as good as a professional at anything, so I just need more practice. But I think that's most of the recap about notable clinical things, and then I will quickly talk about clubs, and then we'll get into class by class breakdown. So as I kind of hinted at in the intro, I'm still in a lot of student orgs. Most student orgs have their elections to change positions and everything around April-ish. ASDA for our chapter is doing it right now, actually, though, this week. So I'm running for a chapter president against another classmate. So we'll see if I stay on a position on the core board or not. Depends who gets elected. I'll let you all know in the intro next week. Hopefully I have good news though. But currently I'm the Lunch and Learn coordinator for ASDA, which is part of the core executive board. My first year I was the pre-dental chair, which is part of the general board. And Lunch and Learn, I have quite a bit of responsibilities. We usually charge organizations to come talk to us, so like dental companies and things, and that is a source of revenue for our chapter to plan other events for our members. And then the Lunch and Learns themselves, or the social networking events, however that would be, like off-campus dinner and drinks where they bring some dentists and the recruiters to talk to us, or if we host them at our school and they have a presentation and provide gift cards or provide food. All of that is informative events for the members, and I'm the one facilitating all of that. So I'm communicating with the different vendors and companies, getting them scheduled, getting it approved by school administration, and then helping them get everything going days up to the event. And then I also helped with a lot of other stuff for just general chapter needs, and tried to help like the general board with their positions, whether it's community service or fundraising or social, whatever it may be. But that has definitely kept me busy this semester. But I'm also in a handful of other clubs that I have leadership in, and I think that Next year, I'm going to stay in all the clubs that I have a leadership in right now, but I'm probably going to not get a membership in a lot of the clubs that I'm just a general member of. So the clubs that I have leadership in, we can start with that. I just mentioned ASDA, and then AAWD is the American Association for Women Dentists, and I'm the vice president of our chapter right now, and the elections for that, where I'll run for president, will probably be in April-ish because the D4s graduate in May. And then I'm also on the general board. So basically there's like a core board and a general board for a lot of the bigger clubs. The core board is like your high up positions. And then your general board is like a ton of positions that help like little committees and things and have like less responsibilities. And there might be 2 people sharing a role. So like people can be involved and they don't have as much on their plate kind of a thing. So for AO, which is Alpha Omega Dental Society, it used to be Dental Fraternity, but at our initiation this year, they made it clear that they were changing the name nationally to be more inclusive, so calling it a society because it is co-ed. So I think that there's some certain connotations with the word fraternity, which is why they switched to society. So AO Society, Dental Society, I just have one tiny position, but it's been nice because I've been able to go to the overall e-board meetings and kind of help with giving ideas and things and trying to make it valuable for the members. But my role, as I mentioned in the intro, is D1 Transition Committee. So like I said, it's a committee. It's me and 2 other students. So it's not even that much on my plate because we can kind of share the load. And our only job is to do those academic previews at the start of each semester for our D1 members to give them advice for their classes. So it's like once a semester thing and it's not too bad. And then for other clubs, I think that's everything I have leadership in. But I'm also a part of the Cosmetic Dental Society, Dental Student Business Association, and Christian Dental Association. I mentioned the Bible studies. We do Bible studies in small groups, and that I actually am a leader of. But because it's a Christian group and like a no dues, it's not really structured the same as a normal club. It's just more of students with the same interest gathering as like a support and community thing. So we have leaders, but we don't have set roles like a president and a treasurer. We just have 3 students, including myself, that are leaders to help lead studies and like facilitate things as need be. I think that's all the organizations I'm in though. I feel like I'm forgetting some, but it's a lot. And the ones that I had roles in, particularly ASDA, was the one that took up the most time this semester, but it's been super enjoyable. Like we had a lot of fun events, especially fall. It seems so long ago now that it's January when I'm recording this, but fall is football season and University of Michigan is a Big Ten school. Super, super excited and passionate about football. So every year ASDA hosts tailgates for each football game that's at home on the golf course right across the street from the stadium. So I was helping set up for all those and got to attend all of them, and it was super fun. And some of them are like sponsored by companies again, so they bring like food and drink and music, and it's a really good time. And then we had, as I said, a lot of informative and networking events through ASDA as well. And hopefully this semester we're going to get more like community service and again, like a big socials going. It just is pending like safety, because in the fall it was of course a lot easier to be doing things outside and we didn't have like Omicron that was so contagious and everything. So TBD for how ASDA and all the other clubs are going to have to pivot and transition this semester for safety and making sure that everyone is taken care of in the best way possible. I think that's everything for clubs though, so we can get into the breakdown of class by class. Okay, to make this as accurate as possible, I pulled up my transcript. That way I can see class by class, how many credits, what my grades turned out as, and all that super, super interesting stuff, I suppose, if you're curious how dental school works. But we were in 20.25 credits, at least I was, because I had my selectives course that was half a credit. I'll just start with that one, jumping right in. Selectives, if you don't listen to the podcast, at University of Michigan, we have a pathways program. So when you come in, you get to take like 2 semesters to kind of learn about how Pathways works and learn about your options. But essentially, you pick one of two paths. You either pick immersion, which is a research pathway where you would come up with your project and find a faculty mentor, and you'd work on that all throughout dental school. And then selectives is an elective course pathway. So you take extra things that you're interested in on top of your normal curriculum. And they're usually pass-fail, and they're just really great ways, honestly, to enhance your education and things that you actually want to be taking. So my first one I took was clinical rotations, basically. So we got to do rotations at some off-site clinics. And then this past semester, was presentation skills. So that, like, some of you might be like, oh my gosh, no, I would not want to take that. But you don't have to take it. I took it because I was actually interested in it. And yes, I do the podcast. Yes, I do YouTube. And that's kind of a form of presenting. But I really wanted to take it because I do present to pre-dental clubs fairly often, like a few times a semester. So I really wanted to learn how to improve that. And eventually, I think that some scope of my dental career will involve mentorship, perhaps like writing or presenting something to the dental community or to dental students. I don't know the scope of it yet, but I feel like that's something that will be part of my routine. So I figured I would pick up some skills from that class. And I passed. All you really had to do was show up to class. It was every other week. And then you had to do a final presentation. And the presentation was on any topic you wanted under the sun. I think it had to be under 10 minutes. And they had kind of a specific way they liked it presented. It was more like TED Talk format. So your slides didn't have like bullets and words. It was more like a picture to make the audience feel something. And then they'd be paying attention to what you're actually saying. So it was a different type of presentation format than I'd ever done. And I did take away that I kind of want to condense my slides a little bit that I present to pre-dental clubs. I'm still going to keep some words on them. This class basically said like less than 5 words a slide or something, which is useful, again, for a presentation like a TED Talk where you're trying to influence people or make people feel a certain way. But for, let's say, a lecture in class, you can't do that. Like, you need the words there because it's a study resource for students. So I'm going to kind of go with like a hybrid. I'll take away some things from that class, but not apply every single thing because I don't necessarily think it's applicable if students want to reference my slides and try to recap what I was talking about. I don't want to take all the words away. So that was presentation skills. I passed. It was half a credit. And I guess before we get into the other classes, it would be useful to let you know how excited I was that this was my best semester GPA-wise yet in dental school. I can look back really quick because I have all the semesters here. So first semester of D1 year, we start in the summer in June. It's like a half term, June to August. And we had 10.5 credits and I got like a 3.46 it says. And then the fall, we moved to Ann Arbor, full course load, full semester, 23.75 credits. I had a 3.3, so it went down a little bit. And then the next semester, winter of D1 year, I got a 3.55. Summer, so between D1 year and then now I'm starting D2 year, the summer term. It's a full summer term, so it's April through August, and I got a 3.51. So again, you can see that after the first couple semesters, I kind of got the hang of it, was more up in the 3.5 range. And then this past semester, my D2 fall, so second semester of D2 year, I got a 3.73, which for me is awesome. As an undergrad, to get into dental school, I'm sure a lot of you worry about your grades, and I did too. I didn't have too many low grades. I did pretty poorly in physics, and then my first semester of college in general, I got a low GPA because I didn't really know what a good GPA was, or competitive, I guess I should say, GPA was. And I didn't really have an idea of what I was supposed to be doing to get into dental school. But after joining pre-dental club, I kind of was like, oh, okay, I need to hit these goals and I need to do these activities. And I did that and improved my grades. But I was overall like a 3.9 something, like a low 3.9 when I applied to dental schools. So you can see that my GPA overall has dropped a lot in dental school. It kind of can be a testament to people wondering, is undergrad harder, the same as dental school? Dental school is just a lot more on your plate, and as you hear me talking about in the beginning of this episode, I do a lot of stuff extracurricularly because I feel that that is what's going to really make my dental school experience as great as possible. The connections that I'm making with people in dentistry, whether they're my classmates, other dental students, practicing dentists, dental organizations, dental companies, all of that I think is what's going to really give my dental school experience that extra oomph that can push me forward in my career. So I have a lot extra on my plate. I know I keep saying extra, but I have a lot of other things that I choose to do on top of taking 20 plus credits. So that could also be a reason my grades are the way they are. And knowing that I want to be a general dentist, I don't need to apply for a specialty program. Dental associate positions don't particularly care about your GPA. They care about your actual clinical skills. So the lecture-based classes that are part of this GPA calculation, I look at them as learning opportunities. I try to get as much as I can out of them, but I don't necessarily stress about whether I got a B plus or an A minus. I just try to watch a lecture and think, how is this going to apply to patients? How will this look in clinic? What is the most important things that I can get out of this class? So for me, I don't worry too much about my grades per se. I'm just trying to think about how they're going to affect me as a clinician and try to learn as much as I can. But there's a difference between learning as much as you can and learning what you think is going to be on the exam and memorizing like crazy and then forgetting things, So that's why, another reason perhaps my grades are lower in dental school than undergrad. But I also just think having that many hard classes, of course, makes your GPA go down a little bit compared to from undergrad to dental school. But as I said, I got a 3.737 this semester, so kind of like 3.74, I suppose, which is a lot better than the past couple that went up a lot. So I was really proud of myself. It was 20.25 credits, and I think the biggest reason that happened is when I read through these course names, you're going to see we had like one more systems class, which is basically a body system. So we've taken nervous system, musculoskeletal system. What else did we take? Cardiovascular, respiratory, genitourinary, and then we only had one left this semester, which was gastrointestinal system. So now we're totally done with systems classes, and I also think that GI system, which I can talk about that class now, was 3 credits, and it was probably one of the easiest, if not the easiest, system class that we've had so far, and I was able to get an A minus in it with not too much stress, which was great because I prefer to focus on the classes that are super dental focused. There's some things that you take away from these systems classes that are important because we do need to understand the whole body, because a lot of that influences your dental health or vice versa, especially when it comes to medications that patients are taking for certain reasons that can still influence how things are going in their mouth and other conditions and problems they might be having that we need to be aware of. So that's why we take classes about every body system. Even though we are doctors of the mouth, it's still important for us to know those things. But that class, not much to say, pretty easy and straightforward for the most part. Then all the other classes were really dental focused, and that is a big part, I think, of why my grades went up also, because I enjoyed studying for them so much more, because they were so applicable to what I was seeing in clinic when I'm assisting, to what just I know is going to come in clinic when I'm the care provider, and it was just a lot more interesting, to be honest. So I'll just go down the list of the classes that I haven't talked about yet. I've talked about 2 for you. I think we had like 11 classes or something. So the next one is Orofacial Complex Health 3. Super easy class. You're pretty much guaranteed an A if you do the work, which is nice. It was a lot of random information. Every lecture was like a totally different topic. There were some on taste, there were some on occlusion. So it was all over the place. But I got an A plus in that. It was 2 credit hours, and you just could do extra credit assignments based on the lecture, like participation assignments even. And they gave you extra credit points. We had a midterm and a final, and then infinite extra credit, however much you needed to get an A if you were willing to do the work. The next class was Periodontology 2. So we usually take a few perio classes every semester, and some of them are more microbiology focused, so talking about the actual bacteria in your mouth, whether they're good or bad bacteria, whether they cause caries or they fight caries even. And then we also had another perio class. But this one, Periodontology 2, that I got a B+ in, was, I would say, the harder one. It was mostly microbiome focused, so it was more like giving us clinical studies and research articles and lots of graphs of like 500 different bacteria and like really random niche facts to memorize. So I didn't get too much out of that. I wish that I did, but I got a B+ in it, and it was 1 credit. And it was definitely like harder for a perio class because it was, the best way to explain it, like microbiome focused. The next class was one of my favorites, Principles of Endodontics 1, so endo, our first exposure to endo. I don't want to be an endodontist, but I still think it's fascinating, especially the research going on with regenerative endodontics that might be in the field as time goes on. But it was very basic, like different types of treatment options and different types of injuries and how you might treat them, children versus adults. And it was just so clinically relevant. It was so fascinating because we've learned that like root canals exist, but we don't really know what a root canal therapy or treatment actually is or what other options are. So it was really nice to learn about it. It was only 1 credit hour though. I feel like it should have been more. And I got an A. We basically had a lecture to watch each week, and then we took a quiz about it the following week, and then we had another lecture to watch, and there were like live Zooms, and there were case studies. And I appreciate classes that either quiz you or give you weekly homework or something, because it forces me to really learn the material. And what was nice was with the quizzes, if you got below a 70, you were able to retake it and then get the 70%. So you could basically like remediate any quiz, which is a reason that I was able to get my grade higher, because I did well on all of them except for one, but then I was able to retake it and get that passing score, which I think allowed me to get a good grade in the class. In addition to the case studies and quizzes, we also had a midterm and a final. And then the next class is Comprehensive Care Clinic, which we have every semester. So that includes our assisting requirements. It's just pass-fail if you go to all your rotations and you do all your requirements. So it also has under its umbrella our perio rotation, our assisting in the VIX clinic, and then all of the ACE rotations and radiology rotations. Then clinical foundations is our sim lab, and this is what's cool. So sim lab, that's drilling and filling, but this time it was just crown prep. So it's prepping a tooth for a crown and making a temporary crown out of acrylic. But I got an A+ in sim lab, which is not my normal. So I was really proud of myself, and it feels so nice because, of course, you need to treatment plan and understand disease conditions and all of that as a dentist. But the main thing that a lot of people judge dentistry by is the actual handiwork that you're doing in the mouth and how long it lasts, and making sure you're not causing patients any pain long term and you're fixing their disease or their occlusion problems. Like that hands-on work is a bulk of what being a good dentist is. So it's really nice to see that I'm improving my sim lab grades as time goes on. And that's 3 credits because we had it twice a week. And then the next class is Diagnostic Sciences 2, which I was also really surprised and proud of my grade in that class. I got an A-. And that was because that class also had weekly quizzes and participation and a few other things that helped boost your grade, in addition to a midterm and a final. Both the midterm and the final were in person. All of our other classes pretty much gave online exams because the classes were online. But that one we had to go in person to take, which I think just adds a different type of stress since we've been online for so long. Like you get more sensitive to hearing like the person next to you tapping their foot or like clicking their mouse. So it's different to adjust back to in-person exams. But I was happy, really, really happy actually with my grade in that class because it was super tough. It was essentially looking at radiographs and figuring out what disease or condition the patient may have and understanding which conditions are cancerous, and then between the cancers, are they malignant or benign, and coming up with differential diagnoses based on descriptions of lesions. So it looks like this, so it could be this or this. It's most likely this because of these facts, most likely not this one because of these facts. So it was a lot of information, and I was proud of myself for learning as much as I could. And I walked away with an A-, and it was a 1 credit class, but it was a lot more stress and work than just 1 credit. I already talked about presentation skills, which was pass-fail, and then the other clinical foundations class we had that I mentioned in the intro was like my least favorite. And again, it's nothing personal to anybody. It's just that dentures were not enjoyable for me and they were challenging. And I got a B in that class. I also found the quizzes and the midterm and the final to be very hard in addition to the actual handiwork. So we had a midterm where we had to make a custom tray as part of the practical, and then it had a written component. Making the custom tray was super easy. Got full points on that. And then I don't know what I got on the midterm, maybe like a C+ or a B-. And then on the final, I think I did about the same, like a B-. But I studied so much for that final, so it was really frustrating that I still didn't even get a good score on it. But it's just a hard class. It's a lot of information to know about occlusion, about movements where you can test how the teeth are touching with like canine guidance and all sorts of things. And like, it's very hard to answer a lot of the questions because they'll ask about, if you have this result, what do you need to change? And then each answer choice seems so similar except for like one small thing. And it's just hard to picture a clinical scenario via words versus seeing it in person. I think a lot of us would understand what to do if we had the patient and the faculty there in front of us and we were looking at it. We'd be like, oh yeah, this needs to go this way so that it ends up occluding the correct way. But reading and description was just really tough. So I think that's a lot of the reason the midterm and final were hard. But I mean, a B, totally fine with a B. And it was a 2-credit class because we had like written and like lectures and stuff to watch, as well as showing up for making our denture. Each week we just kind of did a different part of the process that you would do to create a denture for a patient. And this was totally a dentulous patient, meaning that they had no teeth, top and bottom. So we were making them a complete denture, top and bottom. 3 classes left. So Perio Therapy 1 is the other perio class that we took, 1 credit, and I finished with an A-. I honestly thought I would get an A in this class, but because of how hard some of the other classes were, like ortho, endo, diagnostic, I just didn't give this class as much time as I should have to get the A, but I'm totally fine with the A-, as I mentioned that I am more worried about what I can learn versus my actual grade. And this class differs from the other perio class because it's perio therapy. So it's perio treatment options, perio treatment planning, and kind of guidelines for what maybe pocket depths you're looking at and what different treatment you would do based on that. And then we have GI system, which I already talked about. And lastly, ortho diagnosis. So our first orthodontics class, I got an A+ in that one, and it was 2 credit hours. This was another class that if you did all the work and tried your best, you should get an A in. The final and the midterm were both intensely case-based, as well as endo. I don't think I mentioned that, but they were very case-based. You couldn't just like memorize information and get a good score. You had to really understand the material, and that helped me feel more confident in my ability to be a great clinician in the future. I'm not saying I know everything by any means, but I learned a lot. And that's so nice to say that I learned a lot. And I know that as the next semesters go on, I'll continue learning a lot for these different courses. And like this semester we're in peds, for example. So learning more about all the different avenues of dentistry other than just restorative that we're practicing in SimLab. Now learning more about pros through dentures and bridges and partial dentures versus complete dentures, orthodontics, endo, pediatrics. It all is going to come together really nicely, I think, and again, just make me feel more competent. So I'm really thankful that I had this last semester and that I was able to learn so much. I feel more confident every single semester in dental school, and I'm just hoping for the best as I eventually will be treating patients at the end of this term. So I'm in my 3rd semester of my 2nd year, our D2 winter, and come May, I will receive my patient pool and start making appointments and start treating patients. It's not just cleanings. We go right into doing whatever the patient needs, whether it is their 6-month cleaning or exam, or they need fillings, they need crowns, they need dentures, whatever it is. We just jump right into it. So eager for that. I feel ready, not in the sense that I think I'm going to be perfect, but in the sense that I'm ready to give it a go. I'm ready to start learning more to continue on to the next phase of dental school. So that's the recap of D2 Fall. I probably forgot a lot of stuff, but if you listen every week, I intro and talk about what happened the past week. So that's definitely more in depth of what's been going on, but I think I covered the main points of the semester. So I hope this episode was interesting, and I will talk to you next week with a guest. Her name is Dr. Gabby, and she specializes in TMJ and restorative, sleep medicine, kind of some more niche areas of dentistry that not every general dentist will talk about. And she's also a mom and a practice owner. So we talk about all of that in next week's episode.